Morning, everyone. Welcome to our weekly forum. My name is Don Infante. I'm the president of the Regency Oaks Resident Organization. We're here today with Brant and all the directors, and we're going to give you a great update. Brant's going to give some COVID updates, and we hope to have some good news. It's not quite here yet, but we're going to have it pretty soon. So welcome. The only thing missing is you, but we're glad you're all tuned in. So with that, I'll say adios for now and turn it over to Brant.
Good morning, everybody, and welcome to our Friday Forum. We're glad you're able to join us. I hope we have some valuable information to share with you today. We're going to start with a COVID update. We're going to look at the United States and then delve down into what's happening across the state of Florida, Pinellas County, and here at Regency Oaks. Let's start by going directly to the board.
All right, here's the Florida data. We've had about 654,000 cases with 40,000 hospitalizations. If you look in the center of the map, you can see the color code. The darker the blue, the higher number of cases. Miami-Dade, Broward County continues to be problematic for the state. It is accounting for the vast majority of new cases here in Florida, followed by Hillsborough County, Pinellas County, there along the coast, right under the T in the Tampa, you can see is the light gray blue. And so our county numbers continue to improve. Look at the two charts over on the right-hand side. The top one in yellow is the number of new cases by resident by day. You can see it continues to trend downward. And then the fatalities by date of death in the white right below it continues to show steady improvement day over day, strong downward trajectory, very encouraging numbers for the state of Florida. Let's take a look at testing and what's happening with that here in the state of Florida. You can see the daily new cases. This is for the week, and it's this week it's down. Last week it was slightly up, so that's a good trend. The daily testing, this is 0.09 test per 1,000 people. That testing ratio continues to get better week over week. And then the last chart over on the right-hand side is the daily percent of positives. This is a 7-day moving average. And we're about 13.4%. You can see that this is above the baseline. The baseline is that dotted blue line. So we continue to run just a little bit above that target that the governor has set for the state of Florida.
Okay, so the one other number that I wanted to share with you is Pinellas County. So we're at 20,507 cases here in Pinellas County. That only went up about 67 cases overnight. And remember, Pinellas County is approaching nearly 1 million people in terms of population. And the number of fatalities is up to 697. But it hadn't gone up yesterday and only went up 5 yesterday. So the treatment modalities and the therapies that they are providing to COVID patients in our urgent centers and acute care hospitals continue to be more effective, and fewer people are dying from a COVID diagnosis. Across the United States, we went up from 6,363 to 6,397. That was a pretty minimal increase based upon what we've seen in the past, and the fatalities just went up nearly 1,000. So across the country, we are seeing improvement in the numbers, and I think we're making real headway in overcoming COVID. Our testing rates we've already talked about, but our hospitalizations in our specific zip code, there have been 390 hospitalizations since the start of COVID back in the middle of March. So Pinellas County continues to have a very low number of hospitalizations, which means that our health centers and urgent care centers have never been overwhelmed, and the resources that residents need are available. So now I'm going to turn it over to Leslie and ask her to give you an update on the specific numbers here at Regency Oaks. Leslie?
Happy Friday, Regency Oaks. Today, our numbers here on campus for independent living resident quarantines, we have 14. For skilled nursing residents, we have 6. And for assisted living, we have 0. For our quarantines for staff members, we have 1 in independent living, 3 in skilled nursing, and 1 in assisted living. For COVID-19 testing, we have for independent living residents is 0, skilled nursing residents 0, and assisted living residents is 0. All across the board for all levels of care for residents are 0, and we're proud to be having that. For employees, we currently have 0 in independent living that are being tested, and we have 110 in skilled nursing that are being tested and 15 in assisted living for our weekly testing numbers. For COVID confirmed cases, we have our 8 residents from the previous time, and employees is 19. So overall, our testing results, again for residents, we've had 8, and negative results, we've had 382. For associates testing, the 19 positive, and for negative results are 778. Thank you.
Okay, as Don had alluded to in his opening remarks, Regency Oaks is prepared to take the next steps in reopening our community. And we have submitted and made application to advance and take those steps. We were anticipating having those approvals today, but as of this morning, we do not. I wanted to go back to the board and take a look at that application process and show you where we stand and why we felt so comfortable in getting ready to advance to the next stages.
So here is the actual application that we submit in order to move to the next stage. It starts over on the right-hand column. It's the you see the 3 zeros. Those are the number of active pending resident cases across all level of care. And as Leslie mentioned, we have no one in IL, no one in AL, no one in skilled nursing that we suspect of having COVID or are tracking. And so that's the very first requirement. So we're positive there. The next column is the number of employee cases over the last 14 days. In IL, we've had no one suspected, and in skilled nursing, we've had 2 cases that we are suspect of. The last date for a new employee case was back on the 7th, and that was an associate in our skilled nursing center that is currently under quarantine. The next number is that 2.0, and that's the downward trajectory of documented cases within a 14-day period, and we've seen it's at 2%, very low number for Pinellas County. That's per 100,000 people. The next line you'll see is a 3. That's the county case rate, and it is less than benchmark. And you can see that that continues to decline as well. The next line you'll see is yellow and 53. This is the death rate in the state. This is color-coded. It's green, yellow, or red. We get a yellow precautionary stage, and then our count is 53 fatalities per 100,000 population. Column R, the next one, is the COVID case rate. This is the number of individuals who have contracted COVID in the state and whether or not it is under or over benchmark. For the state of Florida, it's red. That's a stop. And we are at 2,938. So even though this is the only one of the criteria that we did not meet, we decided to proceed for 2 reasons. One is, you will recall, in the middle of August, maybe the second week of August, the cases per thousand were up to almost 17,000, and now we're down to 2,938. And so that's a significant improvement, and the trend has been consistently downward. The next date is the International Health Metrics data, and their estimated date of when Regency Oaks, or more specifically our community situated in Pinellas County, would be eligible to move to the next phase 3 would be 11/10. We've taken a look at the data, we've taken a look at our metrics, and we believe that we're able to move forward now, and that we're not going to have to wait until November. So we've made application. Let's see if we don't get a response sometime later this afternoon, or hopefully Monday by the latest.
Okay, so now you have the COVID update, and again, as soon as we hear something, we will share that with you instantly. And I know the one question that I'm asked 10 times a day, when are we going to unlock the side doors? I will share with you that part of our Move Forward plan was requesting to unlock those side doors. So keep your fingers crossed, and maybe as soon as Monday, we'll see those side doors being unlocked. All right, we're going to move on with the rest of our reports, and I'm going to turn it over to our skilled nursing home administrator. Gerard?
Good morning. I'm Gerard from the Health Center. Just an update from last week. We have tested all residents in the skilled nursing center again over the last couple of days, and we will be getting those results probably Monday or Tuesday at the latest. Last week's tests all came back negative, which is an excellent sign. We did test all employees last week. And as Brent mentioned earlier in his report, one employee came back positive, so we have to wait 2 weeks before we open up visitation based on that. That employee was not involved with residents on a consistent level, so we're not concerned too much about a contamination there, but we're checking it. And we will have those employee results Monday for the testing we just did in the last 2 days. So everything's doing real well there on that front. We feel pretty confident we were able to contain the little mini outbreak that we did have there. The last piece is the visitation policy. We did mail those out. You should have received it if you have any loved one that's in the health center or in the ALF right now. You should have received that policy. It went out on Tuesday. If you did not receive it, please reach out to me. Just call me in the health center. I will send it over to you, or I'll hand deliver it to you, so you should have it. But it spells out in generic form how we're going to go about the visitation once we're past the positive testing that we're going through. So we're not quite there yet to implement it, but we're required to put it together, and we've done so. And I think you'll be satisfied with it. That's our goal, is to get visitors back into the health center to visit their loved ones. We know that's yours as well, and we're looking forward to that happening. Thank you.
Good morning, everyone. Happy Friday. This is Jesse Rosalie, your EVS director. I just want to go over some good changes for next week. We'll be inviting Clearwater Carpet again here for the third floor shampooing. So that will take place on Wednesday, September 16th. We're going to have the third floor north being shampooed. So this is a great opportunity for you to remove any items from out your door. And so we could detail those areas on Wednesday, September 16th. And that'll be the third floor north. Thursday, September 17th, we're going to have the third floor south being detailed. And we'll put flyers out there, as you know. And the following week, we'll give you an update on what's going to happen with Clearwater Carpets as well. Thank you and have a great day.
Hi, and happy Friday from Sales and Marketing. I'm Perry. We had a good week this week. We received 3 deposits. We'll be welcoming some new residents to come in and join you in the near future, and we'll speak more about that as their move-in date approaches. The biggest thing I want to remind you about today is don't forget about our resident referral program that is $5,000. So please let us know if you've got anyone that we can contact that you can be a great reference for as we continue to bring new residents into the community. Hope you have a great weekend. Thanks.
Good morning, Ricky Baca, Food and Beverage, Johnny Hubbs, Executive Chef. Just 2 small things here. Next week we're going to be adding a hamburger and a hot dog to our dining rooms, dine-in only. And also we'll be adding more flavors of ice cream. And I'd also like to give a special thanks to Bill Rogers for coming and talking about the dining room experience. Thank you and have a great weekend.
My name is Bill Rogers from the North Building. I've been in the dining room every evening since the dining room reopened on August 25th. It was so welcoming. It was nice to have the students greeting us as we were seated. Everyone was seated appropriately. It was nice seeing people we hadn't seen for quite a while. The meals hit the spot. As the days went by, more choices were added and also delicious selections of ice cream. I'm certain everyone returning to the dining room will be pleasantly surprised. I feel everyone will feel great leaving their apartment and getting back to normalcy. Give it a try, and I'm sure you will keep coming back. The last 2 evenings, on Wednesday and Thursday, it seemed like more people were in there, and particularly on Wednesday. And last night, just to mention, I had a delicious meal. I started off with large grapes, no seeds, and beautiful strawberries. And then I had a lettuce wedge with blue cheese dressing, which was delicious. Also, shrimp louis, which I haven't had in quite a while, with the large shrimp and the delicious sauce. Also sliced tomatoes and hard-boiled eggs sliced, and it really hit the spot. And the other night, for the chocolate raspberry ripple ice cream, which was delicious. So it's really since we were able to get back, it really has changed my attitude about things, and it's well worth everyone coming back and enjoying themselves. Thank you.
Good morning, Regency Oaks, and happy Friday. I wanted to thank everyone who came to our Wind Down Wednesday. It was wonderful. A very nice, quaint group with our sangria provided by dining. As well as just a reminder that this Sunday it is Grandparents' Day, so we want to send all of our love to our grandparents here at Regency Oaks, whether far or near. We have you in your thoughts, and we hope you have a great weekend. Thank you.
Well, Brant, one of our old-time residents asked some old-time questions. They want to know about the bus. They want to know about the town hall. What's the status of it? They want to know about assisted living and memory care. What's the status of that? Well, that's the question for this week, young man. Have at it.
Well, Don, I have an old-time answer for all of those inquiries. I do have a bit of an update on the bus. The bus rolled off the assembly line on the 30th of August. It got sent somewhere in Indiana for the installation of the interior finishes, and we are expecting delivery the first week of October. So it's been a long wait, depending upon how many years you want to go back and count that. You will recall we had ordered the bus with Brookdale, and right before the sale and transition of the company, Brookdale decided to keep the new bus, and we had to start the process all over again. So we look forward to welcoming that new bus to our fleet. It should be the first week of October. The town hall, I honestly don't have much of an update. Joanna Guzik has been after me every single week to give an update and put it in the Oaks and share it with the residents. And Johanna and I reached out to the development officer, Ted Macbeth at LCS, to try to get a specific update. And Ted's response is, we're working on it, but we're not at a point where we feel comfortable sharing the conceptual drawings. And so I'm hoping that Ted reaches a higher comfort level here in the next couple of weeks, and that we can get those conceptual drawings, get them out to the residents, put them up on a screen, and see what we have. We do have a subcommittee in our building and grounds team that is going to be working with us once we get the conceptual drawings and helping us bring that to a finished project. So still anticipating breaking ground this year. So that project is moving forward. It's just right now in a secret stage. In terms of the assisted living expansion and the memory care conversion over at our skilled nursing, We still believe that that is on track. It is a 2021 project. We have included those funds in our capital budgets that we are putting together right now for next year. And so I do anticipate that that activity is going to get underway sometime in February or March in terms of advancing the expansion of assisted living.
Okay, well, now you have it. There is our great forum for this week. I want to thank Brent. I want to thank the directors for positive news, positive updates, and more positive news to come. So thank you all. Have a great weekend, and God bless.